Now that President Trump has unveiled his America First health care plan, how does it compare to Joe Biden's plan, and which plan is better for you, the American? Senior fellow at National Taxpayers Union, Mattie Duppler, joins me live with her thoughts. Mattie, as always, it's great to have you here. Let us begin with the president's America First health care plan. We're going to put it up on the screen, and I want to draw everybody's attention to one specific thing, that executive order to protect those with pre-existing conditions. Does this put to rest once and for all the claims by Democrats that Trump does not want to protect people with pre-existing conditions?
Well, you would think so, but we're in election season, Todd. So, of course, there will continue to be allegations being thrown about what the president's executive order does and doesn't do. I think one of the most remarkable things about the executive order is it really is just laying out common sense differences between what the president would do in a second term and what actually is happening with our healthcare system in the country. I mean, the common sense things that were laid out in this executive order are things like telemedicine, allowing for people to access their own health records, things that Americans are consistently perplexed about and why they don't already exist in law. I think if the president continues to draw that contrast, not only between himself and Joe Biden, but also between himself and these common sense conflicts that Americans typically have with the healthcare system, that will set him up for success in November.
All right, Mattie, let's take a look at the Joe Biden healthcare plan. And of course, the one overarching aspect of this is that unlike the president, Joe Biden wants to expand the Affordable Care Act. What else should Americans be focusing on in the Biden plan?
Here's the challenge with the Affordable Care Act, otherwise known as Obamacare, of course, is that it was promised by the Obama-Biden administration as something that would eliminate coverage gaps for Americans, and that's simply not the case. We saw data last week from the Census Bureau that almost 30 million Americans still don't have coverage. Obamacare does not offer that universal coverage that seemed to be at the core of the promise made by Vice President Biden and President Obama. The other thing to keep in mind, President Trump, with the Tax Cut and Jobs Act, zeroed out the individual mandate. Vice President Biden has said that he would, of course, bring that back. The thing about the individual mandate is that the people who can least afford it are the ones who are paying it. 80% of Americans who have to pay the individual mandate make less than $50,000 a year. So you've heard Vice President Biden talk a lot about if you make less than $400,000, you won't pay more taxes under his administration. That's absolutely false. The individual mandate is the number one thing that I would zero in on when you're talking about health care with the Biden administration.
Meantime, along those lines, Mattie, taxes are your jam. I believe that's exactly how it says it in your resume. Means some New York lawmakers hoping to follow New Jersey in raising taxes on millionaires. Look, people in these states, I'm from one of these states, people in these states already pay a lot of taxes. That does include millionaires. There it is on your screen. California, New Jersey, New York are the ones we're highlighting. Who is going to fund these states when the millionaires and people with means move out?
Todd, that's exactly the question. If you tax something, you get less of it. That is the same challenge with income. If you continue to tax your high-income earners, they're not going to tolerate it anymore, especially now with coronavirus, right? It has raised the question for a lot of us city dwellers. I'm in D.C., which is no small tax burden jurisdiction either. It's raised the question of what the trade-offs are that we're making living in a city here. If you continue to abuse the taxpayers who fund the services in these cities, they're not going to tolerate it. They're going to go to lower tax jurisdictions. We see that a lot in income and migration data, that people start voting with their feet.
And keep in mind, the people who have the most mobility are those that have the most money. They can just up and leave and go work somewhere else, and they can buy a house like that. The average person like you and me can't. Mattie Duppler, we always appreciate you being on the show. Have a great weekend.
Thanks, Todd. You too.
Jillian?
Overnight, the Pac-12 and Mountain West